In this video, we'll have a discussion on the third ventricle of the brain. In the last part of the video, we'll be having a discussion of few MCQs from this topic which are asked in various exams. So we'll start with the third ventricle. So if you see the cerebral hemisphere like this, so this is one half of the cerebral hemisphere. We can see corpus callosum here. So this is the corpus callosum. This is the rostrum of the corpus callosum here. And this is the fornix. And here you can see thalamus here. What are drawing at this color is the thalamus. So this is thalamus, and below that we can see the hypothalamus here. So what you see here is corpus callosum. This is the fornix. In between this you are able to see septum pellucidum, and here you see the thalamus and hypothalamus. So this is the thalamus and hypothalamus. So this is one half of a cerebral hemisphere. And you can see another half of a cerebral hemisphere on the other side. So in between the two halves of the cerebral hemisphere, that is in between the thalamus and hypothalamus, on either side you can see a slit like cavity which is known as a third ventricle. So the third ventricle is actually a cavity which is bounded by the thalamus and the hypothalamus. So that is a narrow slit like cavity which is lined with ependyma, which is present between the thalamus and hypothalamus on both sides of the cerebral hemisphere. So to say a few words about the third ventricle. So what is this third ventricle? It is a cavity which is bounded by thalamus and hypothalamus. So in other words, we can also say that it is a midline cavity of the diencephalon. Midline cavity of diencephalon. So it is a median cleft between the two thalami. So this third ventricle, being a cavity, is filled with a cerebrospinal fluid. So if you see that this is the one cerebral hemisphere, and you have the thalamus and hypothalamus here, and this is another cerebral hemisphere. You have thalamus and hypothalamus here. So if you see slit like cavity between the two thalamus, the thalami and hypothalami on both sides, there is a slit like cavity here. So this slit like cavity is known as a third ventricle. So this is a narrow slit like cavity which is present between the two thalami. So that is the introduction of the third ventricle. Now we will go into the roof, floor and anterior posterior walls of the third ventricle. So to discuss the boundaries of this ventricle, we are drawing the important structures one by one here. After that, we will be mentioning the structures. So here you can see that on cerebral hemisphere, you can see the corpus callosum here. So this structure is the corpus callosum. So this is the rostrum of the corpus callosum, and here you can see the fornix here. So this is the fornix, and there is a septum pellucidum here. So you can color this. So this green colored structure is the septum pellucidum. Okay. I have drawn this with another color here, and next we are going to discuss the important structures here. So the important structures here are the thalamus and the hypothalamus here. You can see that below that you can see the thalamus here. So this is the thalamus, and below that you can see, you are able to see the hypothalamus. So which is this structure? So this is the thalamus and this is the hypothalamus. We'll color this. And separating the thalamus and hypothalamus, you can see a hypothalamic sulcus here. So this is the hypothalamic sulcus which is separating the thalamus and the hypothalamus. Now these are the important two structures which forms the lateral wall of the third ventricle. So you know that these are the two thalami here. In between this you can see a slit-like cavity known as the third ventricle. So the medial surface of the thalamus and hypothalamus will be forming the lateral wall of the third ventricle. So these two structures are very important. Now we are going to draw some another structures here. So now near the rostrum of the corpus callosum, you can see an anterior, this green color structure is known as the anterior commissure. So this structure is known as the anterior commissure. And so we can know an important structure here, that is the which is this structure, that is the optic chiasma here. So this is the optic chiasma. So this structure is the optic chiasma. So and joining the optic chiasma with the anterior commissure, we have another structure. So that structure is known as the lamina terminalis. So this structure, which is joining the anterior commissure with the optic chiasma, is known as the lamina terminalis. Now, so if you go on like this to the inferior aspect of the ventricle, we can see a stalk here which is extending from the hypothalamus to the posterior pituitary, that is known as the stalk of this pituitary, which is extending from the hypothalamus to the posterior pituitary, that is known as the infundibulum. So you can see the infundibulum here. So if you go on like this, the next structure which you are going to see on the inferior aspect is the mammillary body. So this is the mammillary body which you see here. So this structure is the mammillary body. And beyond that you can see the posterior perforator substance here. So if you continue drawing like this, so it goes on like this. So here next to the medullary body, you are able to see the posterior perforated substance here. So this structure is known as the posterior perforated substance. Now next to that we can see a part of the midbrain here. So this part is known as, which is a part of the midbrain, is the tegmentum of the midbrain. So that is the tegmentum of midbrain. Now you can see that the cavity of the third ventricle is continuous posterior inferiorly with the cavity of the fourth ventricle. So third ventricle is communicating, here you can see the fourth ventricle here. So third ventricle is communicating with the fourth ventricle through this structure is known as the cerebral aqueduct or ductus sylvian. So this is a cerebral aqueduct through which the third ventricle is communicating with the fourth ventricle. Now you can see there is a communication between the third ventricle and the lateral ventricle. So that communication is present here between the phonics and the hypothalamic sulcus here. So this one is the communication between the third ventricle and the lateral ventricle. So that is also known as the That communication is also known as the interventricular foramen, or it is also called foramen of Monro. So in simple words, we can see that the third ventricle is communicating with the fourth ventricle through the cerebral aqueduct, which is present posterior inferior on the posterior inferior to the third ventricle. Now there is a communication between the third ventricle and the lateral ventricle through the foramen of Monro. So that is a simple explanation. And you can see some more structures here on the posterior aspect of the third ventricle. So on the posterior aspect of the third ventricle, you can see a posterior commissure. Like the anterior commissure, you're having a posterior commissure here. So this one is the posterior commissure. So and the posterior aspect, you have a gland here which is known as the, so this gland is known as the pineal gland. So pineal gland is located on the posterior aspect of the third ventricle. So this is the pineal gland, and you can see a commissure here, that is the habencular commissure here on the posterior aspect. So this commissure is known as the habencular commissure. And if you see the roof of this third ventricle, you can see that there is an ependyma, that is a layer of ependyma which is stretching across the thalamus from its roof. So and this ependyma is lining the undersurface of the tila choroida of the third ventricle. So tila choroida, that is a double fold of pia mater which is extending into the roof of the third ventricle here. So this is the tila choroida which is present in the roof of the third ventricle. So the roof of the third ventricle has the ependyma and also the tila choroidae. Tila choroidae. Choroidae. So tila choroida of the third ventricle is present on the roof, and this tila choroida gets modified to become the choroid plexus of the third ventricle. So these are the capillaries which are secreting the cerebrospinal fluid. So these consist of choroid plexus also. So choroid plexus, ependyma and the tila choroidae, all this are related to the roof of the third ventricle. So having drawn all these structures and the formation of the third ventricle here, now we'll discuss one by one about the roof, floor, anterior and posterior wall of the third ventricle. So at first we will start with the roof. So we have just discussed now about the roof. So here you can see the roof of the third ventricle here. So roof is formed by the ependyma, and the ependyma is lining the undersurface of the tila choroidae, and the choroid plexus of the third ventricle, it is projecting downwards from the roof. So which are the structures forming the roof of the third ventricle? So these are the ependyma, which is lining the undersurface of the tila choroidae. Tila choroidae. And there is a choroid plexus which is projecting downwards into the third ventricle from the roof. So important structures are ependyma, tila choroidae and choroid plexus forming the roof. Now we will see about the anterior wall. Now if we look at the anterior wall, so just look at the anterior wall. So if you look at the anterior wall, this is the anterior wall. So if this is the third ventricle, the anterior wall is this. So this is the anterior wall. So in the anterior wall, you can see the anterior commissure here, and you can see another structure, that is the lamina terminalis. So lamina terminalis, anterior commissure, and also the anterior column of the fornix is also forming the anterior wall. So anterior wall is formed by the anterior columns of fornix, the anterior commissure, and also the lamina terminalis. So another important structure, which is an important part, which is frequently asked in all exam, is the floor of the third ventricle. This is very important, but it is very easy if you look at the diagram. You can see that this much part, so this much part extending from the optic chiasma to the tegmentum is forming the floor of the third ventricle. So this is the floor of the third ventricle. So we will start with the structures one by one. What is this? This is the optic chiasma. So optic chiasma forms the floor. So what is the next structure which you see here? This one is the infundibulum, which is the star connecting the hypothalamus to the posterior pituitary. So infundibulum. So which is the next structure you see here? This is the mammillary body. So mammillary body. So which is the other structure? It is a posterior perforated substance. Posterior perforated substance. And at last, which is this structure? This is the tegmentum of the midbrain. That is the upper end of tegmentum of midbrain. Now we have discussed about the roof, anterior wall, floor. Now which is the posterior wall? So the posterior wall is, so you can see the posterior wall here. So look at this structure. This is the posterior aspect. So posterior aspect of the third ventricle. So this is the posterior aspect. In posterior aspect, first you can see the cerebral aqueduct, which is connecting the cavity of the third ventricle with the fourth ventricle. Next structure is the posterior commissure, and next structure is the pineal gland and the appendicular commissure. So all these structures will form the posterior wall. Which are the structures? Cerebral aqueduct, then pineal gland, posterior commission, and habencular commission. So only one left out is the lateral wall. So we have just seen that the third ventricle is a cavity which is formed between the thalamus and hypothalamus on the two cerebral hemisphere. So the medial surface of the thalamus and hypothalamus and also the hypothalamic sulcus will be forming the lateral wall. So this structure, that is thalamus, hypothalamus, hypothalamic sulcus, will be forming the lateral wall of the third ventricle. So lateral wall is formed by the medial surface of thalamus, hypothalamus, and also by the hypothalamic sulcus. So one point is that there is an interthalamic adhesion which is present in the thalamus, which connects the medial surface of the two thalami. So this interthalamic adhesion is connecting the lateral walls of the third ventricle. So this structure is the interthalamic adhesion. That is an additional point here. So we have discussed about all this structure, and the third ventricle is also having some recesses. We will discuss about that now. So while discussing about the recess of the third ventricle, what is this recess? It is actually a prolongation of the cavity of the third ventricle here. So recesses can be discussed like this. There is a recess here. This recess is known as, which is present just above the optic chiasma, that is called the optic recess. So optic recess is present just above the optic chiasma. Optic chiasma is forming the inferior, it is forming the floor of the third ventricle, and the other structures above this, that is the linea temporalis, will be forming the anterior wall of the third ventricle. So at the junction of the anterior wall with the floor of the third ventricle, you can see a recess which is known as the optic recess, which is present near to the optic chiasma. And near this region, that is near the infundibulum, you can see the infundibular recess. Infundibular recess. And there is a recess which is projecting in the stack of the pineal gland, which is called the pineal recess. And there is above this you can see the suprapineal recess, which is actually diverticulum of the roof of this ventricle. So here you can see the suprapineal recess. So overall, how many recesses you have? The third ventricle is having 4 recesses, that is optic recess, infundibular recess, there is a pineal recess, and the suprapineal recess. So that is all about the recesses of the third ventricle. Now we will be discussing the few MCQs from this topic, which are already asked in various entrance exam. So the first question is this: the pineal gland forms. First option is floor of the third ventricle. Second is anterior wall of the third ventricle. Third option is posterior wall of the third ventricle. Fourth option is roof of the third ventricle. So we have definitely learned that pineal gland is forming the posterior wall of the third ventricle. So answer is option C, posterior wall of the third ventricle. Now next question is, all are seen in the floor of the third ventricle except. So remember the structures which forms the floor of the third ventricle. It is the infundibulum, it is the optic chiasma, a mammillary body, posterior perforated substance, and also part of a upper part of tegmentum of the midbrain. Here the oculomotor nerve, that is not forming a part of floor of the third ventricle. So option here is option B, oculomotor nerve. Now next question. So last question is, floor of the third ventricle is formed by all except. So remember the structure which is forming the floor of the third ventricle. It is formed by optic chiasma, the infundibulum, the tuberous cinereum, posterior perforated substance and mammillary body, and the tegmentum of the midbrain. Here tuberous cinereum, it is the stalk of the pituitary, which is definitely forming the floor of the third ventricle. Posterior perforated substance is forming the floor of the third ventricle. So tegmenta, of course, forming the floor of the third ventricle. Now the only structure which doesn't form the floor is the anterior pituitary. So option D, anterior pituitary, is the answer to this question. So that is all about the third ventricle. Thank you for watching this video. To see more videos on my channel, please subscribe the channel. Thank you.